right, thank you for staying with the Monday Report Town Hall session. We're talking about the COVID-19 vaccine, the truth and the lies. Let's take some more questions from the audience. We'll start from you. Due to public demand, there are quite a number of them. So we'll take 4 questions at a go. Start here, then go back there. Start with you. Yes.
All right. Thank you so much, Trevor. My name is Victor Solite from St. Paul's University. I'll direct my question to Dr. Mulwa. He's talked about when the deployment of vaccines started, there are some countries that are a bit marginalized. Johnson & Johnson's vaccine is a bit low, the supply is a bit low in the country. Could that be the reason as to why there is a short supply in the country? Yes, thank you so much.
Yeah, you have the microphone over there. Your name?
My name is Anthony. I want to ask our doctor. You say you have a different type of vaccine. Which one is the best?
Sorry?
You say we have a different type of vaccine. Which one is the best?
Okay. All right. Which one is the best vaccine? You have the microphone. Go ahead.
I'm Tina Akal, and my question will be directed to the madam. The vaccines so far have been proven not to be 100% efficient, right? So we have different variants coming up. How sure are we that these vaccines will be able to assist our immune system to sort of curb these variants in a way that they won't be able to affect us?
Okay. 4th question, really quick. Yes.
Okay, I'm Henry Kibet Mwasa from Embakasi East. I'm a young politician and a community health volunteer. My question goes to NMS and Dr. Mulwa there. How are you using community health volunteers? Because of late you have not come out there and trained the CHVs to go out to the population and talk to them. As a CHV, I control 100 households. So you find you go to a person and then you write a referral to go to the Embakasi Health Center. You find them wakuenda hapo. So we are supposed to go to that household. As we were doing door-to-door campaign in politics, we do door-to-door campaign for COVID-19 vaccine. Yeah.
Okay. All right. I'll ask my panelists to be very brief so that we take the last set of questions. Yes, on NMS, we'll start with you, Oluga. How are you using county health volunteers, CHVs?
Yeah, thank you. Thank you very much for that question. As I mentioned earlier, we have achieved 53% full vaccination of our adult population, courtesy of the work that our colleagues, community health volunteers, have been doing. Because of that system, we have a coverage of 79% in Nairobi when it comes to what we call community health units. And it has worked out very effectively. Of course, sometimes there are resource limits because we have to support the CHVs in terms of transport. And so when you see there is a gap, maybe there was still mobilization of resources, but we have really worked well. I think just in addition to that, I wanted to add something that Korir mentioned on the measures that we have taken. In addition to this community health strategy, in Nairobi we have also had a very participatory approach to vaccination. We have sat with KEPSA, we've sat with Kenya Association of Manufacturers, we have sat with the private sector. We have 179 vaccination posts, out of which only 115 are public sector. So you can see the others are private sector. And one of the things that worked very well here in Nairobi is the partnership with the private sector. You remember at the beginning when vaccines were being deployed, companies were even sponsoring their outreaches by themselves. And this is one of the models that we are very proud of, because then it reduces resource utilization by governments, because then you work very seamlessly. And then that's also courtesy of our partnership programs here in Nairobi. So we want to extend that especially to the colleges, to the schools, to the parents, so that then we minimize the disinformation, as was asked by some people here, and also we reach out to the younger people who we have not reached out, and then we reach out to the hard-to-reach population. For example, in places like Mukuru, which is part of Embakasi, that you are mentioning, Embakasi South, we have hard-to-reach areas that, again, we need to deploy other strategies of protecting our CHVs. One of our CHVs this was actually attacked during our vaccination campaign. And so we have to also make sure that we are using strategies that protect our CHVs, that make them more secure as they go to the households, so that then we can reach the quote-unquote hesitant group that are still existing.
All right. Dr. Maritim, in terms of variants, and Adrian Terry also is mentioning the same thing. He says a slight variation of the last lady's question on boosters. We've seen Omicron and the likes. Now the major strains. Are current vaccines adequate to elevate or forestall them as well? And they want a name. Which one is most effective?
So that's a very interesting question, and I think I'd alluded to it earlier when we're looking at the most effective vaccines. So when these vaccines were deployed in the clinical trials, we didn't have a clinical trial that tried to give the same, like to randomize 3 different groups and see which one was better. Each vaccine trial was done separately. So we just have different efficacy for the different vaccines. But in the real world setting, we've even had a situation where the vaccines are mixed and matched. So at this point, it's even difficult to say which one will you rank as number 1 vis-a-vis another one. So at this point in time, like I said before, all the vaccines are able to protect against the outcomes that are of interest. And these are, they prevent hospitalization, they prevent severe disease, they prevent death, which are the things we want to prevent. So I can't name and say, this is the best vaccine to go and take.
Do they respond to the different variants?
Yeah. So with regard to the different variants, one of the things we have to remember, when these vaccines were first designed, the circulating strains were the Wuhan strains. Those are called the ancestral strains. But as the pandemic has continued, we've had the Delta viruses, we've had the Omicron viruses, which were the most recent, and I think there are even newer variants that are currently circulating. So in the recent past, because initially the companies were still testing to see if these vaccines would really work in protecting, and they offered some protection. So they've gone back and tried to redesign the vaccines to suit the new circulating variants. But just to remind us, so far the vaccines have been able to offer a significant amount of protection. Most of the vaccines, particularly the mRNA vaccines, were not able to fully protect against the Omicron, but people got Omicron, but they had a milder illness, and still the mortality, like the people who died, were less. And it seemed that actually the Omicron provided a natural booster for people who got infected.
All right.
Yeah.
Dr. Mulwa, there was a question for you from Victor.
Yes, very quick one. We had a severe marginalization, especially in the low and middle income economies, Kenya being one of them. Africa was marginalized in terms of vaccines access. WHO was all over, the Director General in particular, saying that vaccine nationalization. The rich countries bought all the vaccines, so we could not access the vaccines. In fact, the African countries came up with the AVAT mechanism, which is the African Vaccines Access Task Force, which was to mobilize the African countries in a way that they could access the vaccines, because they could not compete with the wealthier nations. So that actually, even our country, Kenya, was buying about 10 million vaccines through that AVAT mechanism. As of the end of last month, we had only received 3.8 million of those out of the 13 million that we expected from that mechanism. And it was a frustrating moment, but after, and that's why when you look at the statistics, 68% of the population globally have at least been vaccinated once. When you look at the stats in the African countries, it's only 22% of the population. Look at, we have done a third of what the rest of the globe has done. So that, of course, is as a result of that, because we were not able to access the vaccines early enough, when the demand was there, when everyone wanted to, when we really wanted to have the vaccines. But those are global challenges. Those are beyond any of us seated in this room. And yes.
All right. Let's take the final set of questions, because we're running out of time here. I'll start with you, then cross over there, and have the other two back there. Yes.
Thank you so much, Trevor, for the opportunity. And I really want to thank the entire session for such an informative point and part. My name is Melon Laibich. I'm a student at the Technical University of Kenya, pursuing human nutrition and dietetics. And being a student under the School of Health and Biomedical Science, I want to give a take in this discussion that we've had a lot of myths and misconceptions in regards to COVID-19 pandemic and COVID-19 vaccine. And I want to say that these have caused low positive information in regards to COVID-19 vaccine, and therefore we need a lot of capacity building, most especially in the community level, to sensitize the community on the need and the importance to be vaccinated. Let us remind them that this vaccine is not meant to harm them, but rather it's meant to encourage them to build the immune system. And again, I want to say that we've had a lot of misinformations in regards to the side effects of the COVID-19 vaccine. I want to encourage the entire community and the people at large that they should all be aware that even any kind of treatment comes along with a side effect, but this vaccine went through a Ministry of Health, and therefore that is why it has been advised that it should be given to the people and the entire nation. All right. Just one question, kindly. I want to pose a question whereby I want to look at it in this angle. During the COVID-19, many schools broke down, churches and many other organizations, and this caused youths, most especially students and the adolescent stage, to engage in activities such as early pregnancy, such as drug and substance abuse. What do you think the government should put in place so that in case of any other such kind of crisis, we may not experience such kind of early pregnancies, drug and substance abuse, and any other kind of thing?
Oluga, you'll handle that. Let's go to Kosgei.
Thank you so much, Trevor. My name is Kosgei Liosi. I'm a final year student from the Department of Chemistry, University of Nairobi, and also the chairman, University of Nairobi Student Association, Chiromo Campus. I have a tight question. This is my question. We've had observable resistance amongst Africans in taking the COVID-19. Reason being, we've had a misconception that COVID-19 was meant to get rid of Africans. What measures is the Minister of Health taking so that Africans can get rid of that misconception? Another question to make my tie successful. We've got so many celebrity figures, sports, not limited to media personnel like news anchors like Trevor Mbija. Why don't the Ministry of Health take advantage of them, since most of the youth are followers of these public figures? Thank you.
Okay. One question each, please. Yes.
Okay. Thank you, Trevor. My name is Bibian Machika Tamara from Skastare constituency. I have two questions.
One question, please.
Okay. Thank you. If I may ask, there is some sentiment in the community that most of the youth and the adults, if they get COVID-19 vaccines, they make them to be impotent and lower their libido. What are the measures have you put in place as MOH as the matters concerns? The second question is about when you get the first dose, which either if it is Moderna or AstraZeneca, and then the time you go to get booster, you are being given the other dose. Suppose you have been given Moderna, and then you go to get booster, you are being given JJ. What are the measures have you put in place if Moderna is not effective to the antibodies of the people?
Over there.
Good evening. My name is Elon Albert from St. Paul's University. My question is directed to Dr. Maritim. Now, we have talked about the global recommendations of administering vaccines. But now my question solely bases on lactating mothers. Now, given the fact that maybe a lactating mother by chance contracts HIV, not HIV, but the COVID disease, how are we sure that this child that is breastfeeding will not have contracted the COVID-19? Because now, and yes, the fact that now we are certain that maybe the child will contract the COVID disease, why is it possible not for them to be vaccinated, owing to the fact that you have alluded to the fact that we have the global recommendation on matters to do with vaccines?
All right. Very brief answers, please, because I'm trying to see if I can take maybe 2 more questions as we close on this. The gentleman over there and the lady in yellow. So, yes, let's start. Dr. Luga, you can start with the early pregnancy abuse of drugs.
Yeah, thank you. Yes, thank you for pointing that out. One of the biggest bad outcomes of COVID-19 pandemic, apart from the economic ravage, the people that died, the people that were hospitalized for long and still are suffering either complications or financial hardships, we have also had a very difficult time with teenage pregnancies all over the country, and we've been working very closely with the Ministry of Health. All over the country, there is nearly 20% teenage pregnancies over that period. In Nairobi alone, 10% teenage pregnancies. We even saw pregnancies as low as 10 to 14 years during that period. And we have now launched a triple threat campaign where we are working with Nyumba Kumi, we are working with our community healthcare workers, we are working with the national government administrative officers, education, and also we are working with a number of parents and also peer educators like yourselves and other younger people to try and do a few things. One of them, of course, is to reduce the stigma of reporting gender-based violence, which includes defilement. In Nairobi also we're having a challenge where some of even the teenage pregnancies are also caused by teenagers themselves. So basically children impregnating children. And so we are working very closely with schools and trying to look at what are the safety mechanisms. Nairobi is a bit unique, unlike other counties, because where we've found out in several settlements where people are not very connected with their neighbors. And so the mechanism for what we call community or social community protection, where your neighbor becomes very responsible, needs a different approach in Nairobi than in the villages where perhaps your neighbor is also a relative or an uncle. So here we are deploying, and again through our community health initiatives, and identification mechanisms for persons who are vulnerable, and especially teenagers who are vulnerable, so that we put them in social support units. And we hope that this could be important in other pandemics, especially pandemics that cause teenagers to be at home, and especially during economic vulnerabilities where people do not have jobs, they're not going to school. And this is something that we are also inviting the participation of everyone, and because we are also reaching out with sex education, we are also reaching out with including enforcement, where also people who are not being very responsible also needs to be arrested, and people who are endangering the lives of younger people, especially younger girls, because it is not just affecting teenage pregnancies. We have also seen an increase in STI, we have seen an increase in HIV incidences over that period, and we have also seen an increase, for example, nearly 5,000 gender-based violence cases and assaults. Okay. So this is a bigger discussion that may not be exhausted here, but yes, it's also been compounded and made worse by COVID-19 pandemic, and thank you for pointing that out.
All right. Dr. Maritim, in quick succession, was this brought to get rid of Africans? Most you'd say that it's going to cause importance. Can you mix and match? Really quick. Okay, so we don't have evidence to show that the vaccine actually can cause impotence, because I know this has been a major myth circulating among the young people and among the male, because people fear that if they get vaccinated, they can lose their power. And there was also the concern about the libido. There is no evidence scientifically to show that the current vaccines that we have actually cause
reduction in sexual potency, both in the male as well as the female. The second question is around the mix and match doses. So evidence from real-world setting and even from clinical trials have shown that mix and match actually works. Because remember, when we had the problem with the blood clots in Europe, all the people who received an AstraZeneca first dose then were advised to receive an mRNA second dose. And based on that, actually a clinical trial that had been designed in Spain actually demonstrated that there was a good immune response even when you mix the dose. If you started with AstraZeneca and gave a Pfizer booster and vice versa. So currently we are recommending, I think in the government schedule, the initial guidance was to give the same dose of first and second dose, but I think some of the vaccines were not available. But because the evidence was already there globally, then we allowed for mix and match. When you go for your booster, definitely the recommendation is to try and get a booster from a different mechanism. So if your first doses were the same like AstraZeneca, then your booster would be an mRNA vaccine, maybe Pfizer or Moderna. Then there was a last question
on whether this was brought in to affect Africans, and also there's been that myth that this was a disease manufactured in the lab.
Yeah, so we haven't found evidence because, as you all realize, when the pandemic started, I think the focus shifted to try and find out the blame of where it came from because the disease was evolving fairly fast. So people focused a lot of effort to control the pandemic, and we know that the pandemic has not yet fully finished. So whether it was manufactured and created to finish Africans, I can't say that with a lot of conviction, but I think we are grateful because there had been predictions that Africa would suffer the worst consequences of this pandemic. But I think there are some factors that we cannot even explain that seem to have protected us. Maybe our youthful population, maybe the sunshine that we have throughout the year, maybe being largely outdoors. Some of the things that have really protected us, because as all of you watched, we saw the pandemic move from Europe, Italy, to go to America, to Brazil, and even went to India. But Africa, we haven't really had catastrophic outcomes of the pandemic, and we pray that it remains like this for the remaining time. But you have to remember, we also had some of the harshest interventions, like the lockdowns, the masking mandates, and things like that, which partly contributed, and even the uptake of vaccines that have been. So I think one of the things I want to really emphasize, because I can see many of us are not even masking, hand hygiene has gone through the roof, like no one is performing hand hygiene. Vaccine still remains the most important intervention, because once you have the jab on your body, then you know that you have the protection, whether you have that guarantee that you're protected as an individual, and you're able to even protect your loved ones. So I'd really urge all the youth who are listening, who have not been vaccinated, to come forth and vaccinated, because it's your responsibility to really protect the people around you, particularly your parents who are likely to be older, and other vulnerable people like your grandparents. So I really want to encourage the youth so that you take that individual responsibility to get the vaccination so that you can protect the people who are surrounding.
Okay, Dr. Mulo, finally on lactating mothers, can they still get the jab?
The jab, and Dr. Maritim is here. She's sitting there.
You're passing that to her. Okay,
that's the question I was looking for, about the lactating mother who will can get the COVID. So one of the things that was of concern, and it was really unfortunate, is as the pandemic went on, we had noticeable increase in deaths of pregnant women. So far, all the facts that we know is that when someone is pregnant and they get COVID-19, it contributes to a poor outcome, like a death in the mother, or even an early delivery of the baby, so you get premature deliveries. So one of the concerns was, are these vaccines safe to be given in pregnancy? And there were actually databases that were developed, because now the initial group that was targeted for vaccination, regardless of where people were really the healthcare workers, to protect them as frontline. And we know a lot of healthcare workers, even globally, because majority of them maybe would be in the nursing cadre, were female. And therefore, we have a lot of people who got the vaccine. Some of them were not aware they were pregnant. Some of them were aware they were pregnant, but the risks were too high. So it's really between a rock and a hard place. And therefore, there was a register that was developed, a registry to follow up the outcomes of these women women and see whether the baby was born with any defects and any malformations or something like that. But so far the data has shown that the vaccines are safe in pregnancy. And it's because you're looking at either losing the mother to COVID-19 or having the benefits of the vaccine. So the evidence that we have, particularly for the mRNA vaccines, is that they are safe, they are effective, and they protect the mothers in pregnancy. So we were among the first countries in Africa really to allow and make a recommendation for vaccination of pregnant women, with the caveat that we'll follow them up in terms of the delivery and follow up the children that are delivered. The same also applies for mothers who are breastfeeding, who are nursing the little baby, because when they are vaccinated, then they are able to be protected. So you have a mother and a baby who's alive, rather than, because we had an unfortunate scenario during the pandemic where a lot of fathers have been left with their newborn babies because the mothers actually died. And as doctors, we even lost our colleagues who are pregnant, because some of them, even when the recommendation was made, or at some point there was a lot of delay as we waited for evidence to make the recommendation, and unfortunately we lost some of our colleagues who are pregnant at that particular time.
Okay.
But so far, the vaccines are safe.
All right, we've really pressed for time, but I'll take the final 3 questions really quick, and then you'll answer them plus your closing remarks. Start from you, sir.
Thank you very much, Trevor, and our 3 doctors for this informative session. My question is, during the pandemic, we've seen a change in lifestyle for both the old and the young. And what is the effectiveness of the change in lifestyle in this pandemic? And the second question is that, what is the role of genetics? How is genetics affecting the spread and the effect of COVID-19 in people's body?
Okay. Second question over there.
I'm Irungu Agnes, and my question is about...
Sorry, slightly louder.
I'm Irungu Agnes.
Yes.
My question is about pregnancies. So, for pregnant women and lactating mothers, are there measures for them to take, specific measures for them to take? And is it true that the vaccine boosts their antibodies during pregnancies?
Okay. Hope you got the question. Any other question, really quick, burning question behind you? Yes.
Okay, thank you, Trevor. My question is, there's something about herd immunity, whereby as a country we were able to get a percentage for measles and polio. Do you see us achieving that when it comes to COVID-19?
Okay. Final question back there. Pass the microphone behind you. Behind you. Yeah, over there.
My question is largely on capacity building in terms of this not being quite the last pandemic that we're likely to face, and the challenges that we've already faced during the COVID-19 pandemic. What roles are young medical trainees going to play in the research process, in building capacity, and when a pandemic strikes our country, we go about it?
Capacity building if another pandemic strikes. All right, Dr. Mulu, we'll start with you. You can respond.
I think I'll start with the last question. Yes. That one, we had a very steep learning curve as a country in terms of pandemic preparedness. I think when we began, we had the first meeting, because at the time I was working in the county. Yeah. We were imagining of having just 5 infectious disease units for every county, and we thought that would be enough. Shock on us when the disease came. We moved that to 300. If you look at the number of ICUs, that is capacity that has been increased, oxygen access and all that. So in terms of as a country, we have learned a lot. The one valuable thing that we have learned is the value of engaging the communities. Some question that was not actually answered was the question of how do we ensure that that community engagement, how do we ensure that we use influencers? We are working for young people. We have your peers. We are working with peer young people because we may not understand the language of the younger people. We are using them. We are using influencers. We have used sports people to message on COVID-19. So in terms of learning, the country is in a better place. We are using a whole health systems approach. We are even looking at beyond the health system, asking ourselves, must we get masks? And do you remember some of the supplies that we direly required at the height of COVID-19, we could not get them. So we are building capacity from local manufacturing, from training of healthcare workers, having the equipment, having the technologies. We are even setting up a Moderna plant in this country for manufacture of vaccines for future pandemics. We are also, not just for vaccines for COVID, but looking at even for other routine diseases. We also have the Kenya Biovax, which was established to deal with COVID-19 vaccination as a government, because we are looking at it beyond the COVID-19 pandemic. Then the other issue is, I did not get the issue of lifestyle changes. In terms of, we are having, I would call it epidemiologic transition, where we are having more and more of chronic illnesses rather than the communicable disease, the communicable diseases. I hope you are talking about the change in lifestyle as a result of that. So, but we continue to do advocacy for healthy lifestyles, and we are doing a lot in terms of health promotion. Okay. The one thing we also learned is information management is very, very critical. Okay. We even have tools for rumor tracking. We even have interventions for health promotion in the communities. And we have a mechanism. This week, we were launching a tool where we are able to see, while seated in the office, to see what are the issues in the various communities, what are the messages that have gone out there, what are the rumors that are coming through from communities, so that we are able to dispel them. Because the one thing that, the one dividend that we learned from COVID-19 is for government to build confidence in its people, so that when we say it's dangerous, the people are able to indeed say it's dangerous, because we learned that people are actually playing with fire. When the government was saying this disease is dangerous, you need to mask up, you need to stay at home, people are saying, oh no, why would we have to stay at home? You will die of other things. But we have learned, and this is a global community, that for governments to build confidence in its people, so that the government's position is respectable and is trusted by the citizens. Okay.
Dr. Maritim, as you also make your closing remarks, you can talk about herd immunity as well. There's a question around herd immunity.
Yeah, so the question around the herd immunity, as clearly illustrated, so for certain diseases like measles, we already know that you need to vaccinate to have a coverage of about 92%. So you have to vaccinate a large number of people for you to say you can protect. So how vaccines work is that when you are all vaccinated, the infection cannot move across from one person who's not vaccinated. So anyone who's not vaccinated remains vulnerable. But by vaccinating a large population of people, you prevent that disease from being transmitted to the person who's vulnerable. For COVID-19, there's been an idea that the threshold for herd immunity is 70%, but it's not been attained in many settings to really confirm that it can actually be attainable with that threshold of 70%, but still we are trying, because some of this immunity comes from natural infection, because when someone recovers, you still have some protective antibodies. Some of the immunity also comes from vaccination. But in our country, like from the statistics that we've already had, we are even struggling to reach the target. So I think we need to prove that point, that by actually attaining that a high coverage of the vaccination, and knowing that we are speaking to the people maybe who are still unreached, particularly the youth and the adolescents, to try and see how to improve that number to be able to attain that 70%. Then we can actually be able to say that we've attained herd immunity. The caveat to that also is that we've said that this immunity may be waning over time. So we have to be prepared for that need to revaccinate the people and allow the boost of that immunity to be able to maintain that protectiveness.
Yeah, and this might be for a lifetime now. So after every 6-8 months, we're always getting vaccinated.
Maybe.
Dr. Luga,
thank you. Yeah, so mine is to really thank the communities in Nairobi, because we've had a good run, but of course we have not yet achieved. We still want to get to the 70% by December. So the religious institutions, the Hindu Council, the Christians, the churches, and also the Muslim communities, we've really worked well, especially during the outreaches, to map out the vulnerables, and we now want the same people to now map out the hard to reach, the youth, the people who are working in construction sectors, and the people who are working in the industries, really to get protected in Nairobi. In Nairobi, we want to say that we have learned quite a lot in terms of partnership building, and to move as one unit, not just as government. And perhaps we were not very strong in communication, but the one thing that we have been extremely strong on is community engagement, because we have a very strong community health strategy and community health network. It's the same one that we used to identify the vulnerable people when we were giving the COVID-19 support, which was the cash transfers. It's the same system we used for identifying indigents for NHIF, and it has worked for us in terms of mopping out the people who needed vaccination. But we still have the pockets of the younger people, the pockets of the hard to reach, the pockets of the hesitant people. So we're just calling upon the whole community, everyone, industry, religious communities, schools, parents, that we come out and get to this 70%, because even what my teacher, Dr. Martin, mentions in terms of the belief of 70%, you can only prove it when you get there. When you don't get there, there will never be any evidence even to subject to scientific proof. So I think for us, we want to be very grateful also to the media and to the younger people who are here, and to the influencers, the guys who are in Instagram. We have our theme song, Nai Tuko Chonjo, Pata Chanjo Tuwe Chonjo. So if you get that on the radios, please pass it on to your colleagues. Please make sure that your fellow teenagers know that getting vaccination is saving people's lives. It's saving the whole population, not just themselves. So with that, thank you.
All right. Are there any burning comments or questions that I may have left out? Because this is entirely your session, so I don't want to leave out anyone else. I've been added a few more minutes. Let's start from back there. You haven't said anything. If there are any concerns, you can make a comment or question really fast. By a show of hands, who else feels left out? You already asked a question, but I'll come to you if there's no one else who wants a question. Any other? All right. So start with you, then come here. Okay.
I heard that people who take alcohol should not be vaccinated.
Sorry, say that again?
True. People who take alcohol.
People who take alcohol
should not.
Yeah.
Okay.
I don't know whether it's true, or I want to know the answer from you.
Okay, Dr. Maritim.
Yeah, so actually the people who take alcohol should be the first ones on the queue to be vaccinated. Because when you take alcohol, alcohol is one of those chemicals which will affect your brain, it affects your heart, it affects your liver. It affects even, we find people who take alcohol, they also come with pneumonias and other comorbidities. So alcohol, actually taking a lot of alcohol affects a lot of body systems and would make you develop chronic comorbidities and complications, which put that person at increased risk of severe COVID illness and likelihood of death. So the people who take alcohol should be first on that queue to receive the vaccination, because they are at increased risk of severe illness, and therefore, if they are not vaccinated, they are likely to die should they get COVID-19 or to be hospitalized. So they need to be first on that queue. So there is no contraindication that if you're an alcoholic, so now you are avoiding the vaccination, you should actually get the vaccination.
Okay. Question? Yes, you have another question. You pass the microphone to the front and to the side as well. And there's also another concern. There's a question also here. Let's pass the microphone as we get to you. And then there's another microphone at the back. It'll come through all the way to the front. And there's a concern here from a lady called Gracie on Twitter. She says, please check the newly published peer-reviewed paper by Dr. Asim about the vaccines. She says there's heart disease, miscarriage, death, autoimmune diseases. The list is endless. I don't know whether you've heard of that peer review, but let's hear from you and then come.
Okay, this goes to Dr. Olunga from NMS. I want to first to congratulate Governor Sakaja for fulfilling the promise kulipa community health volunteers. And I want to say it should come from, it should become community health workers, as my guy from the ministry has said. And even we went to the Ruto. We want to increase that stipend from our allowance from 3,000 shillings to 15,000 shillings in Nairobi. You know, the life is hard. So that the community health volunteers can be at the forefront and can have the morale to go out there and talk to the people, because they know the language of the people, they know the vulnerable people, they know who has not gotten COVID-19, they know this misconception and misinformation. Kama watu wa Makanga, watu wa base, we can talk to them because we know their language. And we can talk to the health center, bring that vaccine at where they are, instead of taking them to the health center.
Okay.
Yeah.
Final comment.
Okay, thank you, Trevor. As a public policy analyst and an upcoming government expert, my last comment is that they always say when a man falls, you don't have to laugh at him, but instead you have to learn from what has made him or her to fall. So I want to challenge the newly installed government or the administration that let us put more efforts and let us put more concern in these ministries that are so important, like the Ministry of Health. Of late, we've been reporting cases, people are dying because of, some people are not taking their work seriously. So I want to challenge the ministry, the government, that let us put more focus on these important ministries that they can, they can service Kenya, so they can deliver services to the Kenyans. So let them learn from the past administrations, that let us not again repeat things that were done in the last administration, but let us better these ministries. Of course, not only the Ministry of Health, but all other ministries in the government. With that, thank you.
All right. Thank you for all those brilliant comments, and I want to thank my guests also tonight. But before we close the show, let's cross over to Karen, where my colleague Waiga Mwaura is joining us live.